Hi, Nicole Kelly, nurse practitioner. I'm here at LeBeau Skincare Center, and I am here to educate you on Botox. Botox is simply a medication or purified protein that's used to treat fine lines and wrinkles of the face. These fine lines and wrinkles can be wrinkles across your forehead, horizontal lines, they can be the mad lines between your eyebrows, crow's feet, and we can also use them off-label on the lower face. This is our patient Rose. So Rose and I had a discussion a little earlier, and she's interested in some of the fine lines of her forehead. Yep, you're raising. Go ahead and raise up. Rose is very fortunate at 65 that they are this fine, but these transverse or forehead lines are very amenable to Botox treatment. Go ahead and be mad or scowl or be upset, and you can see the lines created. Some people have 1 line, some people have 11 lines, some people have 3 lines, and we'll treat the muscles here. And go ahead and turn a little bit this way. Give us a big smile. These are called crow's feet. There's a muscle that goes around the eye called the orbicularis oculi. This is probably the number 3 area for Botox treatment. And as far as lower face, go ahead and purse your lips. You can also treat smoker's lines. Rose doesn't really have smoker's lines, nor does she smoke, but certainly know of those patients who have deep lines across their upper lip. Also, while she's doing that, do you see these little dimples in her chin? We can also treat the mentalis muscle. This works very well to smooth the chin. And Rose, go ahead and pull your corners of your mouth down. Right. So some women and men have a turned down mouth, even at rest. So if we give a dose of Botox in the muscle here and here, called your depressor anguli oris, that will help relax this muscle. And then when you are relaxed, the corners of the mouth will turn up. And then moving on down the face as well, go ahead and show me your neck muscles. Yes, do you see these bands right here? These platysmal bands. Botox is also a treatment for these bands that can help smooth those. We are going to treat Rose's forehead, between her eyebrows, and her crow's feet or smile lines. So before we start, she is cleansed, but I'll just do a little double cleanse here. And what I'm going to do is I'm actually going to mark the areas of where I want to place the Botox. Go ahead and turn towards me. Raise your forehead nice and high. Perfect. All right. I do note some veins, and most people have this central vein. So I'm going to put some little marks up this way. And one right about there. She'll get a nice treatment here, but she'll still be able to lift her brow. Go ahead and be mad or scowl. Real mad. Very good. And there's another set of muscles that bring your brow down. Not only does it help treat this line, but also people who are very heavy brow or their brow is down. If we weaken the muscle, then the brow will relax up. And as far as your crow's feet, go ahead and squeeze your eyes shut really tight. Some women like a little lift in their brow. If that's something that's desired, when I treat with Botox, I will bring my Botox up this way a little bit so this part of the muscle can't pull down. Very good. Squeeze your eyes tight. And I'm looking for this muscle to move. Because again, the whole reason Botox works so well and relax is we're targeting muscles. And we're targeting muscles that move the face and hence cause wrinkles in the skin. Botox is the #1 non-surgical cosmetic treatment. It's very safe, given in the right doses and in the right places. All right, I'm going to start with the forehead. And you can completely relax. Good. And here we go. Using a tiny little needle. How does that feel?
Fine.
Good.
Just a little pinch.
A little pinch. And here we go. Awesome. As far as dosing is very different from patient to patient and from women to males. The determination of how much Botox you need will be made, during a consultation. So I'm going to aim for the glabella region between the eyebrows. I use a higher dose here because the muscles here are much stronger. and bulkier than this thin muscle up here. All right, same kind of thing. Actually, I want you to be mad again, and I'm going to look at that muscle again, and now relax. Here we go. 1, 2, 3. Good. Same thing, be mad and relax. We have 2 more injections. Very good. Be mad again and relax. One more in the middle, you don't have to do anything. Perfect. All right. And then we're going to move on to your crow's feet. Botox takes 3 to 5 days to kick in, so to speak. You'll get your peak effect at 2 weeks. And for most patients, Botox will last 3 to 4 months. And then after 3 or 4 months, the muscle starts to regain its ability to contract. And once the muscle starts contracting, then the skin folds right along with it, and that's when you start getting your wrinkle back. And turn this way. As far as any kind of risks, I've never seen Botox cause an infection. You're going to feel me right here. I've never seen an allergic reaction with Botox. And I've never seen a systemic effect of Botox, meaning like I Botox Rose's forehead and now she has weakness in a completely different area of her body. Again, if it's given in the right doses, in the right places, it is a super duper safe treatment. Biggest side effects, really, you can see where she gets a little bit of redness. And that redness will probably be gone by the time that she leaves and goes on to her next destination. We'll stick here. And one more. Perfect. And open your eyes, Rose. Look straight ahead. I'm just going to pinch Rose's skin here a little bit. So the reason I'm doing this, Rose has asked me, and she's had this in the past, she would like a little bit more opening or kind of have a wider eye. So if we give a tiny little Botox right about here, it'll weaken this part of the muscle of the bicularis, and she'll ever so slightly get more of a wider eye or more of an open shell. So go ahead and close your eyes. Here we go, 1, 2, 3. Might smart a little bit in a super small dose. Perfect. All right, come around the other side. And I'm just looking to where her pupil is and finding that perfect spot. And go ahead and close. We'll just start off there. 1, 2, 3. Perfect. All right, how's that feel? It's okay?
It's fine.
Good.
Mm-hmm.
Turn a little bit to your right. And here we go. I'm looking, Rose has a few veins that obviously I'm going to go out of my way to avoid. I know, we were talking about side effects, so one of the immediate side effects is this little bit of redness. There's always a chance for bruising. It's pretty minimal. I won't say it never happens. But with this tiny needle, it rarely happens. Last one. Perfect. All right, so when the treatment's over, really the only restriction that I have, Rose, is you can wash your face, you can shower, you can exercise. My biggest no-no for you is not to rub between your eyebrows or rub your eyes. Okay. And the reason I ask that is because I don't want the Botox to diffuse into a muscle that it wasn't intended for. Okay. And if you do that, if you just follow those directions for about 24 hours, you're fine. And what I'll do is I'll have Rose come back in 2 weeks after she gets her peak effect, somewhere between 2 and 4 weeks. and we'll reevaluate. Certainly the first time a patient comes in, we are trying to figure out the perfect formula for you. So when you come back in, if you love it, we'll just keep the same kind of Botox formula. If you come back in and you still have some movement of the forehead, or you're still moving here, or some persistent crow's feet, we can adjust for that. We can add Botox at that time, and then when you come back your third time, and then we'll adjust the dose appropriately.
Okay.
If you have any questions, I tried to keep this fast and simple for you. Please call LeBeau Skincare Center. Schedule a consultation. It's completely free. I'd love to see you and talk about how Botox can help you.